Hello everyone. In this video we are gonna see about the routes of entry of microorganisms. Microbes can enter the host by breaching epithelial surfaces, inhalation, ingestion or sexual transmission. The major routes of entry of microbes are skin, GIT, respiratory tract, urogenital tract, transmission from mother to fetus. So the first one would be skin. The defense system of the skin is the intact epidermal barrier. It is a mechanical barrier having low pH, producing antimicrobial fatty acids and defensins, and small peptides that are toxic to bacteria. The major cause for the failure of the defense system, that is epidermal barrier, is mechanical injuries, which may occur through one of these: burns, insect bites, needle stick injury, pressure-aided ulcers, punctures, or through direct penetration. So these are the pathogens which damage the epidermal barrier through any of the methods mentioned before. First one, it is a picture of cystosoma. The larva cystosoma can transverse unbroken skin by releasing enzymes that dissolve the skin adhesive proteins that hold the keratinocytes together and cause cystosomiasis. And the next one, it is a Candida albicans. It is a kind of yeast and it is a normal part of the microflora, but sometimes it can cause urinary tract infections, genital infection, oral thrush. It is caused mostly during immunosuppressive states. And next one, it is a Pseudomonas aeruginosa. It is a gram-negative bacteria which causes opportunistic infections, that is, infection which occurs during existing diseases, most notably in cystic fibrosis and traumatic burns. And the next one, it is Lyme disease. It is also called as borreliosis. It is a tick-borne illness caused by the bacterium Borrelia burgdorferi. And the next example is rabies, which is caused by rabies lissa virus, which is a deadly virus which spreads by saliva of infected animals. The next one is malaria and yellow fever. Malaria is caused by a type of plasmodium, namely ovale falciparum vivax malariae and knowlesi, in which mosquito acts as a vector. And even in yellow fever, mosquito acts as the vector. The next major route of entry of microbes would be through GIT. The major defense mechanisms in GIT are: firstly, the gastric epithelium. It is a layer of mucus that covers the gut entirely throughout the length, preventing the access of luminal pathogens to surface epithelium. The acid secreted by the parietal cells in stomach. The HCl lowers the pH, so making it hard for the microbes to thrive. In case of Vibrio cholera, neutralizing the acid in the gut leads to a 1,000-fold increase in the infectivity. Peristaltic movements. Peristalsis is the movement of smooth muscle or GIT which propels the food through the food pipe. Along with the food, it also clears microorganisms, thereby preventing the local overgrowth. Some microbes have lipid envelopes which protect them from host cells. So here comes the pancreatic and bile secretions which can destroy the microorganism with lipid envelopes. The next defense is provided by the gut microbiota. It is also called gut flora or microbiome. These are symbiotic bacteria, archaebacteria, fungi that are present in the healthy human gut. One example here shown is E. coli. These produce vitamins like B12, thiamine, riboflavin, and apart from these they confer immunity and also inhibit colonization and overgrowth of potential pathogens such as Clotridioides difficile. Another important defense mechanism are the Peyer's patches. They are present in ileum and they produce IgA antibodies and can neutralize potential pathogens. So now, the failure of the above seen defense mechanism of GIT can occur by toxins produced by these pathogens. Staph aureus, it produces a powerful exotoxin during its growth in contaminated food, which is a cause for acute food poisoning. Next one, bacterial colonization and toxin production. Here the microbes bind to the intestinal epithelium and multiply in the overlying mucus layer. Example, Vibrio cholerae. This bacteria binds to the intestinal epithelium and produces cholera toxin that causes profuse watery diarrhea called as rice water stools. Another way is through adhesion and mucosal invasion. The pathogens, after adhering to the epithelium, they invade the intestinal mucosa and lamina propria and cause ulceration, inflammation, and hemorrhage that manifest clinically as dysentery. Example: Shigella, Salmonella enterica, Campylobacter jejuni, which causes food poisoning. The next major route of entry of microbes is through respiratory tract, and here too we have natural defense mechanisms to protect. The first one being mucociliary clearance. It is a self-clearing mechanism of the airways. The pathogens get trapped in the nasal mucosa. The ciliary movements of the cilia or the respiratory epithelium causes the movement of mucosa to the pharynx to be swallowed or coughed up. Resident alveolar macrophages provide defense against pathogens which enter through respiratory pathway. Alveolar macrophages are specialized resident phagocytes, constituting the first line of defense. Particles smaller than 5 microns are phagocytized by these leukocytes. Here in the histology slides we could observe the resident alveolar macrophages. Now, the failure of defense mechanism or respiratory tract can occur through the attachment and local proliferation of microbes. Some respiratory viruses attach and enter the epithelial cells in lower respiratory tract and pharynx. Example: influenza virus causing flu. They have enveloped proteins called hemagglutinin that bind to sialic acid on the surface of epithelial cells. Attachment induces the host cells to endocytose the virus, leading to entry and replication. Another way is by ciliary paralysis by toxins. Certain respiratory bacterial pathogens release toxins that enhance their ability to establish an infection by impairing the ciliary activity. Example: Mycoplasma pneumonia causing tracheobronchitis and pneumonia. Bordetella pertussis causing whooping cough. Another way is the pathogens acquiring resistance to killing by phagocytes. It is one of the important ways of establishing an infection. Mycobacterium tuberculosis. It gains a foothold in alveoli by surviving within the phagolysosomes of the microbes. It is due to the virulence factors like cod factor and LAM, lipoarabinomannan factor. The damage to respiratory mucociliary clearance, mechanical ventilation, smoking, cystic fibrosis aids for the superinfection of the bacteria. AIDS and neutropenia causes setting of systemic immunodeficiency, causing pneumocystis jirovecii infection and pulmonary invasive aspergillosis. The next major route of entry of microbes is through the urogenital tract. The major defense mechanisms are urination. Urine contains small number of low virulence bacteria. Urinary tract is protected from infection by regular emptying by micturition. The next major defense mechanism, especially in females, is vaginal microbiota. From puberty till menopause, the vagina is protected from pathogens by lactobacilli, which ferments glucose to lactic acid, producing a low pH environment that suppresses the growth of pathogens. And next one, it is an intact epithelial barrier. This also protects the urogenital tract from infections. And coming to the failure defense mechanisms. Anogenital distance. It is a distance between the genital opening and the anal opening. It is higher in case of males and it is shorter in case of female. So infection from anal canal can spread to genital system in females more commonly. And the next common method is by obstruction or reflux of urine. Obstruction may occur at many levels. Firstly in kidney, where there is Staghorn calculus or tumor of pelvis. Then even in the ureter, where there is tumor of ureter, blood clot, retroperitoneal fibrosis of tumor, then ureteric calculus, and even the uterus during pregnancy gets enlarged and can compress the ureter. Sometimes there is migration of endometrial tissue to some other places other than endometrium like ovary or in ligaments, which enlarges in size and can cause constriction in the ureter. And tumor of the bladder can also cause the constriction of ureter at the point of draining. And the most important cause in males is prostatic enlargement. It is called as BPH, benign prostatic hyperplasia. It causes retention of urine. It causes obstruction of urine. Antibiotics can kill the microflora of the vagina and can cause vaginal candidiasis, which is caused by Candida albicans. This yeast is normally not infective as there is lactobacilli to protect it, but usage of antibiotics kills the lactobacilli. Now coming to the vertical transmission. It is a transmission of infectious agents from the mother to the fetus. It is a common mode of transmission for certain pathogens and may occur through several different routes. It may be through placenta, like seen in congenital rubella syndrome, and it may be transmitted during birth, like in chlamydial conjunctivitis, and even after birth the transmission can happen through the mother's milk. This kind of scenario is seen in cytomegalovirus. Thank you for watching. Goodbye.